Hi everyone, so today we're going to be going over how aspirin works and also explaining what prostaglandins do in respect to inflammation and how inhibiting their formation would reduce inflammation. So salicylates, which are also aspirin or known as aspirin, is a non-selective COX inhibitors. Aspirin exerts its effect primarily by interfering with the biosynthesis of salicylic prostanoids, thromboxane A2, prostacylin, and other prostaglandins. These prostanoids are generated by the enzymatically catalyzed oxidation of arachidonic acid, which it is itself derived from membrane phospholipids. Arachidonic acid is metabolized by the enzyme prostaglandin PGH synthase, which through its cyclooxygenase, which is also the COX, and peroxidase activities results in the production of PGG2 and PGH2, respectively. PGH2 is then modified by specific synthesis, thus producing prostaglandins D2, E2, F2A, I2, and TXA2, all of which mediate specific cellular functions. PGH synthase, also referred to as the COX, exists in two isoforms that have significant homology of their amino acid sequences. A single amino acid substitution in the catalytic site of the enzyme confers selectively to inhibitors of the COX isoforms. The first isoform, also known as the COX1, is constitutively expressed in the endoplasmic reticulum of most cells, including platelets, and results in the synthesis of hemostatic prostaglandins responsible for normal cellular function, including gastric mucosal protection, maintenance of renal blood flow, and regulation of platelet activation and aggregation. The second isoform, the COX2 or COX2, is not routinely present in most mammalian cells, but rather is rapidly inducible by inflammatory stimuli and growth factors and results in the production of prostaglandins that contribute to the inflammatory response. Aspirin imparts its primary antithrombotic effects through the inhibition of PGH synthesis or COX by the irreversible acetylation of a specific serine moiety, serine 530 of COX1 and serine 516 of COX2. In the presence of aspirin, COX1 is completely inactivated, whereas COX2 converts arachidonic acid not to PGH2, but to 15R hydroxyecosatrianic acid, or 15R HETE. And I have a couple diagrams to show you just of the response. There you go, right here. And then also right there. I hope that this helps. Enjoy your weekend.